Welcome to the 2014-2015 Grant Writing Workshop for the Mid-Michigan affiliate of Susan G. Komen. We're looking forward to telling you about Susan G. Komen, Komen Mid-Michigan, and our grant programs. My name is Lisa Bauer, and I'm the Mission Programs Director. My background, I'm an RN with a bachelor's who has worked in women's healthcare most of my career. I worked for Michigan State University's Comprehensive Breast Center as the administrator for their grant through Komen Mid-Michigan prior to coming to this present job. Let's start with a few questions. Don't worry, they're not graded, but they will give us some good jumping off points. The first one is, how much has Susan G. Komen invested in breast cancer research since it was founded? Well, in 1982, Nancy Brinker started Susan G. Komen. Our organization is here today because of a promise Nancy made to her sister Susan, who is dying of breast cancer. Since 1982, the organization, Susan G. Komen, has invested over $755 million in breast cancer research. Who is the largest grassroots network of breast cancer survivors and advocates? Well, we can all guess the answer to that. Susan G. Komen. We have 118 affiliates across the U.S., along with numerous three-day Susan G. Komen walks, which take place across the country. Who founded Komen Mid-Michigan and when? Our own Chris Pearson founded Komen Mid-Michigan in 2001 after a dear aunt succumbed to breast cancer. With a strong family history and now a mother who is a survivor of the disease, Chris has a keen sympathy for those who face the challenges that breast health issues bring. What 7 counties does Komen Mid-Michigan serve? We have grown to encompass Clinton, Eaton, Ingham, Jackson, Livingston, Shiawassee, and Washtenaw counties. How much has Komen Mid-Michigan reinvested into our service area since it was founded? Komen Mid-Michigan has reinvested over $4 million in breast health since 2001. In our area, those funds go to community grants, small grants, education, and support. This number also includes funds sent to the National Susan G. Komen headquarters for research to find a cure. The community profile is the basis for all we do as an affiliate and for all grants. It provides background information about Susan G. Komen and our affiliate. The vast majority of the community profile is the demographic information and cancer statistics that will be necessary to complete an application. Those demographics and statistics were used to determine our funding priorities. Our funding priorities are on the screen, but are of such importance, I'll read them out. The priority number 1 is to promote breast health education and the importance of early detection and screening across our service area, particularly in the cities of Lansing, Jackson, and Ypsilanti, with an emphasis on African American women. Efforts must be detailed and measurable. Priority 2, support access to breast screening and/or diagnostics for uninsured and underinsured women ages 40 through 49 and those aged under 40 with a breast health concern. Efforts must be detailed, measurable, and include rationale for the number of slots for each procedure based on the Affordable Care Act breast screening funding requirements and the breast and cervical cancer program funding decreases. Priority 3, provide breast cancer survivors with programs offering emotional, social, and physical support during and following breast cancer treatment. Efforts must be detailed and measurable. And priority 4, increase visibility and knowledge of the Komen Mid-Michigan affiliate mission throughout its service area. Efforts must be detailed. Applications must pertain to at least one of the first 3 priorities and preferably include the 4th. The request for application, or RFA, in combination with the community profile provides the necessary information and instructions to write an application for a grant from Komen Mid-Michigan. The RFA includes application instructions, grant application dates, and contact information if there are any questions. An important note in the grant writing process: make certain that you have data and/or evidence for your positions, objectives, and actions. The data and evidence from the community profile and your own data and evidence drive what you apply for and why. The important dates that are coming up are on the screen. For our current grantees, a reminder that the 6-month reports are due on October 22nd, 2013, and the final report is due on May 14th, 2014. You'll note that there is a change from the 6-month due date. That was a modification that all of the current grantees are aware of. For those interested in applying for the April 1, 2014 through March 31st, 2015 grant cycle, the dates include the RFA announcement, which was made on September 30th. The RFA and community profile are posted on our website, www.komenmidmichigan.org. Komen Mid-Michigan is all spelled out. Applications opened on Monday, October 7th, 2013, with a firm deadline of Wednesday, December 11th at 5 p.m. Eastern Standard Time. Please note that there are no exceptions for the application deadline. Not the dog ate my thumb drive, I'm having technical difficulties, or I have a question about GEMS. We will be making award notifications on March 10th, 2014, which will allow time to get your program up and running by April 1st. Our grants are all completed on Komen's Grant E-Management System, or GEMS. It's available at https://affiliategrants.komen.org. Once the primary investigator has registered and logged on and gained access to the program, a conflict of interest form on GEMS must be completed. After this has been noted by our office, you are free to work on your grant in GEMS. Having worked on these before, I would make a couple of very strong suggestions. Hit save every 2 minutes or so, as the system will log you out before it tells you it's going to log you out. And 2, type out your narratives in Word and cut and paste them into each section. There are a limited number of characters for each section, and you can get a word count in Word. It also allows for easier wordsmithing and editing, and it allows for a more comprehensive spelling and grammar check. It also saves you for those times when the phone rings, you forget to save, and you come back to a blank screen. There is a GEMS user manual available on our website to make your application process easier. Our website again is komenmidmichigan.org. If you have technical questions as you are working your way through the application, please do not hesitate to contact me at lisa@komenmidmichigan.org. The abstract is the first narrative portion of the application you will write. Although the independent review panel will see your entire application, the affiliate board will only see the abstract and budget. We will talk more about that in a few minutes, but know that the abstract is extremely important. The abstract should be concise and focused. It should include the purpose of the program with an overview of what data or evidence led to this program. A description of the key activities should be specific and include enough detail to show this is a well thought out program with data to support it. All programs must have a mechanism for evaluation. A summary of those should be included in the abstract. Showing the impact your program will have in the breast health education and care of those in our area is an integral part of the application process. The review panel will be looking at a number of factors. They will certainly be looking at the impact your grant will make in your community. Will the project have a substantial positive impact on increasing the percentage of people who enter, stay in, or progress through the continuum of care? Will the project have a substantial impact on the priorities selected? How closely does the project align with the funding priorities stated in the RFA? Does the project have a sufficient and documented plan to evaluate its impact? Feasibility. How likely is it that the objectives and activities will be achieved within the scope of the funded project? Is the project well planned? Is the budget appropriate and realistic? Does the budget justification explain in detail the reasoning and need for the costs associated with the project? Capacity. Does the applicant organization, project director, and his or her team have the expertise to effectively implement all aspects of the project? Is the organization respected and valued by the target population? Is it culturally competent? Collaboration. Does this project enhance collaboration among organizations with similar or complementary goals? Are the roles of the partners appropriate and relevant? Sustainability. Is the project likely to be sustained? Are collaborations, if proposed, likely to be sustained beyond project period? Does the application organization have the sources of funding sufficient to continue the project? Remember, in all of these, provide specific data and evidence-driven thoughts. I cannot drive that point home enough. The review process is fairly straightforward. We utilize an independent review panel which consists of medical professionals, business and community leaders, and financial experts, so every application is reviewed from a number of different perspectives. Each application is reviewed by at least 3 different people. A meeting is held in which all of the reviewers discuss each application. The reviewers come up with a slate or a list in order from the application that had the highest score to the lowest. That slate, along with the abstract and budget from each application, goes to the affiliate board. The board then decides whether to accept the slate as a whole. Funding is granted from the application with the highest score and continues down the slate until the funds are utilized. Notifications will be sent by March 10th. Breast self-awareness is the breast health messaging that many national breast health advocates have adopted, including Komen. We do not support breast self-exam messaging any longer. There are many different forms of breast cancer and breast health issues. Breast self-exam focuses on lumps and bumps and the sense of touch. This does not focus on the other types of symptoms such as a rash, dimpling, nipple discharge, etc. The breast self-awareness cards show 8 areas of awareness utilizing the sense of touch and sight. It encourages us to know what is normal for our bodies, know our risk, to get screened, and to make healthy lifestyle choices. Breast self-awareness messaging information is available on our website. There are a number of breast health education items on shopkomen.com which present breast self-awareness in numerous different languages. You are welcome to take a look at the multitude of breast health education materials available for anyone to use. Grantees are asked to use Komen materials for their program. Please budget for these in your application, knowing that you will receive a discounted price as a grantee for those educational items. All of these are available again at shopkomen.com. We view finding the cure for breast cancer, caring for those who are currently going through treatment, supporting the survivors, and educating those around us as a community effort in which we must all work as partners. Collaboration with each other as individuals and collaboration between different institutions in your area is paramount. As grantees, our networking meetings have proved beneficial. We have shared ideas to troubleshoot similar issues and brainstormed ideas to improve our programs. As we get to know each other, collaboration across organization lines becomes easier. Also, as a grantee, we set up at least 1 site visit per cycle. This allows for more open communication, gives us a better idea about your program, and gives you an opportunity to ask questions. As you are all aware, there are numerous types of media. As a grantee, we will provide you with a thumb drive that includes, among other items, sample press releases and our logos. All messaging for the program for which you have a grant must include Komen Mid-Michigan logo. That messaging would be included in TV, newspapers, flyers, posters, websites, social media, and any other communication. This inclusion allows those who work so hard for our funding to see the impact of their efforts. We could not grant this money for breast health and care without the generous and huge contributions of our volunteers, race and ride participants, and third-party organizers and volunteers. Every dollar that comes in is treated with great consideration before it is granted out. We are excited to announce that our Komen Mid-Michigan race will be Sunday, April 27, 2014 at the state capitol, and that the Ride for the Cure is Saturday, August 2nd, 2014, would be held in Ann Arbor. We are grateful to those who raise funds. We are also grateful to the grantees who carry out the work to educate and care for those in our communities. We are privileged to partner with you to improve breast health of the men and women in our area. Remember, we live here, we race here, we save lives here, and we thank you very much for your time.